Okay.
So my question with this is, because it says gingivitis, a lot of our candidates want to fill that out because there's gingivitis present. It also says AAP1 right next to the gingivitis, and I think that's a little confusing because we often get those both filled out just as this is. Am I correct in assuming that that is incorrect and it should just say AAP2 and they're mutually exclusive between the first checked box and the next row?
This is actually quite a good question, because face value of this, the answer would be B. However, you realize now, as we're becoming more concerned about inflammatory markers in the body, bleeding on probing and gingival inflammatory concerns are concerns in terms of overall body health. So remember, bone is a great metric for predicting prognosis or ultimate outcome, much better than tissue health is, but it doesn't mean we're not interested in inflammation. So the only thing that I get concerned about is if you looked at this slide on face value, to me, the candidate would be saying, here's a patient that has unhealthy gingival tissue, but maybe not a manifestation at bone support level. So they're fairly low risk maybe for periodontal disease. I don't know the age of the patient or some of the other pieces. So my point is, you're correct. Typically from a prognostic value point of view, it's the AAP2 that matters most, and I don't even bother checking off the AAP1. In other words, there's an assumption that there's some inflammatory component. But I do think, and this is where Doug has really interjected a lot more in our perio management piece, is, and he would say, bone is a great metric for building prognosis, but bleeding on probing is a much better metric to manage patients through the hygiene program. I don't know if you don't want to paraphrase how you've put that into perspective, but it's really important. You might want to mention that.
Yeah, no, that'd be correct.
Okay.
Very nice.
So the point though is, under no circumstances, when you just check off, let's say, low risk, does that mean we're not involving these patients in a recare program, right? I mean, we know this is a very slow progressing disease, and we're still obligated to do as good a job in inflammatory management, even if they're resistant patients. So it's not, it doesn't give you a license to eliminate that component.
Okay. And just as a guidance, though, we would tell our exam candidates that those are mutually exclusive. They're not expected to tick off gingivitis and AAP 2, 3, 4.
I typically just put AAP2.
Yeah.
That's
okay.
all I do.
Excellent.
But in my records, there's always a record of the gingival health parameters, bleeding, indices, etc.
So is that something that we should think of reforming this slide to reflect?
The slide, I don't see that changing in the near future. I mean, even this year, you'll see it in the symposium, there was a whole new Plaque Index concept been researched. In other words, typically, if you think about what are the metrics to even track gingival inflammatory components and the result of that, traditionally what people would do when you disclose the patient is track how much biofilm you see on the tooth. Well, the reality is the biofilm on the tooth in terms of periodontal health makes very little difference except what? The marginal position of the plaque. So there's a whole new classification system looking at just the gingival outline for plaque. And so this gets into a lot of little nuances that I think tend to cloud the big picture. So the bottom line is, always in perio, are your teeth going to outlive you, yes or no? And it will create a whole need for a management system to be able to ensure that. That's the idea.
Yeah, but John, when we're coaching our candidates to fill out the diagnostic opinion form, we really should be coaching or guiding them to state the most obvious worst case AAP scenario.
Always.
And I mean, so that's really what the problem is with this issue. And this could get clarified on the tooth number and rationale slide.
Correct.
If you wanted to give some other, hey, I'm only worried about 2 teeth and the rest are great, right?
Yes. In other words, at the moment, Mr. Jones, you don't appear to have suffered the consequences of bone loss, but as you're getting older, your immune system is changing, your resistance factors may not be the same, and you may, with the same level of oral hygiene and inflammation, actually have consequences. I mean, this is the whole piece that'll come out. And by the way, just so you know, I listened to the group. I don't know how many years people have made the suggestion, but this year we'll do implants before bio. So I've switched the order of how the material will come out. So the last day will not be implants. It will be, the second day will be surgery and implants. So you know. But the point is, when we deal with, for instance, the meaning, because you see, the whole thing is not, the form is a guideline to understand the patient. That's what a system is. It's only a crutch. It's only to help you or guide you through a thinking process. Now, obviously we're looking for glaring discrepancies in the thought process. That's what we're really after. But the reality is, for instance, you may have a patient that has had implants for 10 or 15 years without bone loss. But now they have other diseases and immunocompromises on different medications that all of a sudden that same implant that has remained healthy for 15 years suddenly goes down the tubes. And I'm going to show you one of them. Had the implant for 20 years and in the last 2 years lost 8 millimeters of bone. Sick patient now though. And so, trying to look at the magnitude of where we are, we're trying to get a handle on it. And by the way, I don't see the rest of dentistry doing it. Not to this level. The rest of dentistry is into coding, right? Is into insurance coding and on trying to understand how they say something on an electronic form. I'm interested in what is the meaning of that? Because I'm interested in your health. Ultimately, I'm trying to take care of you. And that's the point.